Hello and welcome to Health Digest, your trusted source for all things that concerns your health and well-being. I'm Ogom Ezedimbo. We begin with this story where the World Health Organization has expressed concern over the U.S. administration's recent move to exit the global health body. In a statement from its headquarters in Geneva, the WHO urged the U.S. government to reconsider its decision, emphasizing its readiness to engage in dialogue to preserve their long-standing partnership, which dates back to 1948. This move follows an executive order signed by President Donald Trump upon his return to the White House. If implemented, this would mark the second time the U.S. has withdrawn from the WHO. The statement highlighted that the decision comes amidst the WHO's most extensive reforms in history, aimed at improving accountability, cost-effectiveness, and country-level impact. It also noted that the U.S. contributes approximately 14% of the organization's annual funding and making its involvement critical to global health initiatives. Meanwhile, China has reaffirmed its commitment to the WHO and other multinational agreements such as the Paris Climate Accord. A Foreign Ministry spokesperson, Gu Jiankun, stated that the WHO's role should be strengthened, not weakened, and reiterated China's dedication to international cooperation. Following President Bola Tinubu's directive for the swift transfer of victims from the Suleja fuel tanker explosion to tertiary medical centers, several patients have been admitted to the University of Abuja Teaching Hospital for advanced medical care. Health Digest visited the hospital to assess the situation and brings you updates on the victims' conditions. Please note, viewers' discretion is advised as some visuals may be disturbing.
She come shop. That time I went to work outside work. I be engineer. Now for my workshop the thing fall, the truck, they offload. That time I not there. I dey outside work. That time this boy they can't lose bike. They repair that machine with the owner for the machine. At the time when they offload, they go carry the trailer come. Now 2 trailers there. So they come, they offload the other one. Now in the exhaust blow for that engine where they do offload. These boys they cannot feel run. That time fuel is rough for that side. They want run be that now in they fall inside the fuel. He and Isa is my 2 kids here. They are treated to us fine because since when we will come here, even 10 naira, even 5 naira will not keep about for their something where they give them to drop everything. Will not buy anything. Now only the food. Before we come here, Governor Bago, now he carry us come here. Yes, he give everybody 50,000 more just use and eat with the children first. But we will not kill anything for their tablet.
We have 16 of these victims in our facility. And like he alluded to, that fact is the fact that 16 of them are having various degrees of burns, ranging from 70 to 80 and above. And when that happens, it's really a critical emergency, that can be so terrible. But the good news is that we have the specialists who are up and doing. I don't think any one of us has slept since Sunday night till now, all working around the clock to make sure that we rescue these lives, And it's quite capital intensive in the sense that even on that first day of admission here, we used well over 20 cartons of normal saline just to resuscitate them, and then various degrees of very strong antibiotics were also deployed just to make sure that these victims are rescued, because the major challenge they are going to face in the next 1 week is a challenge of infection. And so everything needs to be done, all hands on deck, to make sure that in terms of fluid replacement, in terms of strong antibiotics, will be all deployed to rescuing them. And gradually, because we know that these burns may not just be limited to the skin, there may be also what we call inhalational burns that may have eroded the respiratory and the GIT system. So we're also quite mindful of that in terms of the kind of nutrition they're also going to be receiving. So we are working in that direction to make sure that in terms of their feeding, we are up to it. Because it's going to be highly specialized, our nutrition and dietetic unit have also been mobilized to make sure that they participate effectively in their treatments. Our nurses, the pharmacists, everybody have been so actively involved in making sure that we rescue this life. And then we're also getting support. As of yesterday, we were called to the Federal Ministry of Health and the Federal Secretariat to receive some items in terms of fluid, in terms of drugs, in terms of other consumables that are needed in carrying out this intervention. So, and we also hope that the promises that have been made, by the Niger State government, the federal government, we hope they will all, we're expecting that such support will come quickly in order to be able to meet the financial burden that may arise in the course of taking care of these victims. This is a critical moment we are now. Majority of them, we've not yet gotten to that stage, but it's going to be a multidisciplinary approach, so to say. We already have a mental health unit or department in our hospital that incorporates the services of psychologists. We have about 3 well-seasoned clinical psychologists are in our system. So they will also be deployed at the right time to intervene in that aspect in terms of rehabilitation. If I told you on Sunday night till Monday morning, if you quantify the amount of money that was spent in making sure that the resuscitative phase took place, was over 2 million already. So because the body system, the skin is quite critical, and if not properly taken care of, it also will affect other internal organs. Each of them, I don't think there's anyone we're going to spend anything less than 6 to 7 million in keeping them within the first 7 days. Yes, because of the active engagement, the active phase of resuscitation that will happen. So if you multiply that out for these 16 people, you're talking about well over 40 million, because it's quite capital intensive managing burns patients. As we speak today, for every attempt you make to see any of them, you are using a face mask, you are using surgical glove, you are using latex glove, you are using, in terms of today, we have even had costs to reorder our gauze, our cotton wool that ordinarily we should have used for 3 months. Within between that Sunday and now, we've almost have exhausted what we had in stock, because 16 is not a small number in terms of active management.
Here is a new and refreshing offer for our esteemed audience across the globe. The new AIT Cloud TV is an online streaming service that offers you attractive opportunities to view our rich, exciting, and entertaining programs anytime, anywhere. AIT Cloud TV is available on the web on www.ait.app, Apple TV, Amazon Fire TV, Roku, and Android TV. You can also download the mobile app from the Google Play Store or the Apple App Store. Simply connect to the internet, download the app, register, and watch live or catch up on unlimited hours of exciting shows. AIT Cloud TV. TV on the go.
In a bid to reduce Nigeria's malaria burden, the federal government has commenced the rollout of the R21 malaria vaccine in Bayelsa and Kebbi states. According to the Minister of Health, Dr. Ali Pati, the vaccine is expected to decrease malaria-related illnesses and death in the country significantly. Health Digest spoke with Professor Lugbenga Ayodeji Mokolu, an expert on malaria, who shed light on the challenges of malaria in Nigeria and the benefits of the R21 vaccine.
Well, malaria remains an important public health condition in Nigeria. By the World Malaria Report, we still have approximately 68 million cases that are estimated to occur in Nigeria annually. Okay. But over the years, we have experienced decline in the malaria burden. The figures we have that are most recent from our 2021 malaria indicator survey, where the prevalence in children is put at about 22%. Okay. That is different from what it was some decades ago, where it was in 2010, where it was 42% thereabout. So you could see there has been some decline over time, but it still remains maybe the condition that is most frequently treated. The fact that we're not testing adequately also allows room for some measure of over-treatment of malaria. But nevertheless, malaria remains a very important condition of public health concern.
Thanks, sir. So the rollout of malaria vaccine in Bayelsa and Kebbi State, what does it mean for Nigeria and the country's malaria burden? Will it reduce cost of expenditure on malaria medicine?
Well, as it is now, first of all, I think we should congratulate the world and also bring that congratulation to Nigeria, to the world, because we eventually found malaria vaccine. It has taken over 50 years of developmental efforts to produce the malaria vaccine. And with the approval of the first vaccine in 2001, a second vaccine had been approved in 2003. And so having those two vaccines in quick succession and knowing that there is a lot of activity going on in the vaccine space is very encouraging to us. Now, we should state it in context. The vaccine is not yet 100% protective, but it has significant protection at about 77% level, and it also had significant effect in reducing the malaria progressing to the severe form, even if the child should have it. It is not an independent, isolated intervention, because we have learned a lesson in the malaria world over time that malaria will never be something solved by a single bullet. It is, first of all, the balance of the activities of the vector, which is the mosquito, the availability of adequate environment, okay, and then the impact on the human host when the infection comes up. So when you look at these various interactions, solving the malaria puzzle is a multi-layered event and multi-dimensional. All right, so the vaccine is an added to the armory that we have in fighting against malaria. We do not encourage that people should discontinue other interventions because of the vaccine. However, now what is the value in the final analysis? The value in the final analysis for the vaccine is that it reduces the total caseload of malaria that we will be having. That's beneficial. It will be reducing deaths attributable to malaria. And if we follow that up with rational behavior in our prescribing by getting people tested, then you can expect that the expenditure on anti-malarials should go down over time. Okay, so to that extent, it holds that potential. But as an individual intervention, it is used in conjunction with the other interventions. The nets should still be used. We still call for environmental management that reduces the habitat for the mosquito. And when somebody has it, the person still needs effective treatment. And then other preventive measures like chemoprevention in pregnancy, chemoprevention in children under 5 that are living in areas of seasonal transmission. All these packages go together. Okay? But the vaccine in the longer run is going to be cost effective for us. Okay, so having it in Bayelsa and Kebbi, that is the resources at our disposal to first of all get a certain volume of vaccine into the country. And we wanted to be sure that rather than sprinkle it all over the place and not being able to give the required 4 doses that a child needs, it was important to have well circumscribed places, starting with the places with the highest burden in the north, and then significant burden also in the south. But we then looked at the population that for the initial 1 million doses that we have, which translates into 250,000 children less than 1, okay, we can start and give each of them their 4 doses, okay, as will be needed. And so when the other doses arrive, then we go to other states. But if we did not go in this circumscribed manner, we might not know where we have gone before and where to go next. So it's strategic, I think it's logical, and let's not despise the days of small beginnings. The Honorable Minister of Health in May this year, Professor Mohamed Ali Pate, had a malaria roundtable, which we call Rethinking Malaria. And part of the output of that is something that has been summarized as the 9-point agenda around malaria elimination. One of those items has to do with local manufacturing as a broad principle. So from the nets to the drugs to the testing kits and now to vaccine, they are part and parcel of that overriding principle of local manufacturing. And the initiatives on several of these are already ongoing, and with very advanced conversations and things like diagnostics, there might soon be the local production in Nigeria of RDTs. Already it has gone very far in terms of that. So same with vaccine. There are people who have also indicated interest in wanting to be participants in the strengthening of capacity for Nigeria to be able to develop vaccine production capabilities. We've had some of this in the country before, okay, so it's not entirely new, but then these are equally very fine and advanced technologies which we have to be working on gradually. But already, in the effectiveness study that I mentioned, we're in collaboration with one of the vaccine manufacturers actually in running that study together, and that will be informing some of the ways out. So Nigeria recognizes its population, it recognizes the market that it has, it recognizes the human resource resident there, and hence taking on the challenge of local production of malaria-related intervention is a well-established understanding within the malaria cycle and other governmental setting. And we are working actually in that direction currently.
And that's it on this edition of Health Digest. Stay informed and take proactive steps towards better health. I'm Ogom Izedimbo. Until next time, stay healthy and stay safe.